Bhutanese charts are one of the premier options we have to monitor the risk zone under which the baby falls. So there is the age on the x-axis and the serum bilirubin on the y-axis. You have both in micromoles and milligrams on either side. It categorizes the babies into low risk zone, low intermediate risk zone, high intermediate risk zone, and the high risk zone. This predicts which baby is going to reach a level needing phototherapy and also guides us on how quickly we should see them and follow up. We have a tool called Bilitool, which is based on the American Academy nomogram or phototherapy chart, and it can be accessed on bilitool.org. Many units use them currently to guide their jaundice treatment, and as I said earlier, the nurses can be empowered to use this chart, so they don't need to call the doctor if it is not needing treatment. Enter the patient's age in hours and the bilirubin value in the unit which is suitable in your unit. Both the options are available for milligram and micromoles. So the Bilitool provides an age-specific risk stratification based on the Bhutanese chart I showed earlier. It gives a suggested action and the follow-up intervals considering the risk factors, and it also gives the phototherapy recommendation, which considers the neurotoxicity risk factors. So this is a screenshot from a baby's entry. So the baby is 45 hours old. Total bilirubin was 12 milligrams per deciliter. So this is on bilitool.org. And it is giving the first reading, which is the categorization of the risk as high intermediate risk. These are the risk factors which we'll be looking at in the next few slides. And it also categorizes the risk zone, lower risk, where it is more than 38 weeks and well baby, medium risk, where the baby is more than 38 weeks with any of these risk factors, or 35 to 37 weeks with no risk factors, and higher risk where the baby is 35 to 37 weeks and having risk factors as well. So your action depends on the risk group. If the baby falls in a lower risk, follow up within 48 hours. If medium risk, you consider phototherapy and you have to recheck within 24 hours if you don't start phototherapy, and higher risk, you would consider phototherapy as well. So moving on to the next part of the Bilitool readings, it gives us the phototherapy recommendation, and here we also have the neurotoxicity risk factors to the side, which will guide us. So basically anything that increases the free bilirubin in the blood or affects the blood-brain barrier. So you have isoimmune hemolytic disease, G6PD deficiency, birth asphyxia, significant lethargy, temperature instability, sepsis, acidosis, and the low serum albumin. Remember that in a premature baby, the albumin may be low as well. And a sick baby usually tends to have acidosis and temperature instability. So all these may affect, and hypoglycemia may affect as well. So we should keep in mind that we should be monitoring the risk of this along with the categorization here. So in the case we discussed, 45 hours of age with 12 milligrams, if the baby was 35 to 37 weeks and had neurotoxicity risk factors, you would start phototherapy at 11 milligrams. And if the baby was more mature or 37 weeks, start at 12.8 milligrams, and if no risk factors at 14.9. So this is a guide again, and just to reiterate that it is an option to provide conventional phototherapy in the hospital or at home at bilirubin levels 2 to 3 milligrams below those shown, or 35 to 50 micromoles per liter. So sometimes depending on the family situation, and remember that if you don't treat, you have to keep bringing them back. So you have the option to admit them and treat pending the insurance coverage and the parents' desire to treat.